This policy regarding Australians in India, are you essentially saying that there isn't a medical need to keep them there, that the health justification the government's using doesn't stack up?
Well, what the government's done by making this announcement is it said that it doesn't trust hotel quarantine. And that's a different message from what we heard as late as last week, where they were claiming 99.9% efficacy of that hotel quarantine system. Now, we agree with them. We agree that hotel quarantine has some flaws. They need to be patched up, and it's reasonable, therefore, to pause the flights for a couple of weeks while those holes are patched up and whilst we get some agreement on a national standard for hotel quarantine.
We've just had pictures coming in of Australian aid arriving on the ground in India today. It was sent over on a Qantas plane, which could carry 200 people. Is it a waste, though, for that plane to come back empty?
Look, it is a waste, and it's disappointing that it'll be coming back empty. And if there's more flights going, then we would certainly hope that the Australian government finds a way to put some vulnerable Australians who are stuck in India at the moment on those planes. Not all of them can afford the uncertainty, the cancelled flights, and of course their mental health must be suffering in a huge way. Not to mention the risk to their physical health of this pandemic occurring in a country whose health system is really struggling to cope with even the basic needs of people with COVID.
Dr. Khorshid, what sort of advice are you getting about the medical documentation being proffered by people wanting to get into Australia? For example, medical certificates saying people are COVID-free. Yesterday we heard some reports of a plane load of people boarding in India, apparently COVID-free, only to have dozens of them be tested as COVID positive once they arrived in Hong Kong. Mark McGowan's talked about this dodgy documentation. Do you have concerns on that front?
Yes, there's no doubt that Australia needs to make its own decisions about the COVID status of anybody entering the country, and that means doing our own tests. Now, it would be great if we could put in a mechanism in other countries that we could really trust, but it is tricky to do in so many countries around the world. And we have to make do with the information that we can access and ensure that the systems that we're using, the quarantine systems, are able to cope with people who are coming back into the country who have the virus. That is the whole point of quarantine. If we knew that nobody coming into quarantine had the virus, then why do we need quarantine? So we're certainly hoping that all efforts will be made to make sure that our system is fit for purpose and can allow us to bring needy Australians back from overseas and especially from India.
We learned today that a senior Victorian quarantine official has been stood down after he refused COVID tests, as well as reportedly an incident where he didn't change his mask at a coffee break. Reportedly, this man said he didn't need tests because he'd been vaccinated. Just to clarify, for anyone who's been vaccinated, if they get symptoms of COVID or if they've been to a hotspot, do they still need to get tested?
Yes, anybody who has symptoms consistent with COVID needs to get tested, full stop. We don't know yet the efficacy of our vaccines at preventing any form of COVID and preventing the transmission of COVID. We do know that they're really effective at stopping you getting sick and ending up in hospital with COVID, and therefore people do require testing if they have been exhibiting any symptoms. Having said that, we have got some data coming in from certain countries around the world showing extremely high efficacy of these vaccines in the real world at preventing people actually catching the disease. And I think that's good news for our vaccination program as we go forward.
Most states are now offering AstraZeneca to over 50s through either mass vaccination clinics or GPs. We are seeing, though, that large numbers of people in the priority category, like in disability care homes, for example, still aren't getting the jab. How much of an indictment on the government is that? Have you got any confidence that the vaccine rollout is improving at speed?
The government have pivoted to try and shore up support for the program and get the numbers up. And by doing so and by rolling out the vaccine to everybody over the age of 50, there is that risk that the focus on making sure those higher priority people are actually done, is lost. So it is absolutely critical that we finish the job in phase 1A, that's those aged care and disability care people, and phase 1B, which includes all our emergency workers and healthcare workers, not to mention Australians over the age of 70. And that's because they are the highest priority groups. They're those that either get sick with COVID if they get it, or they're far more likely to be exposed. And it is important that everyone in those groups puts up their hand and gets in to get a vaccine as soon as possible. For those under the age of 50, there is a little bit of waiting, unfortunately, still involved because we are still relying on those overseas imports of the Pfizer vaccine. But we know that government is doing everything it can to increase those numbers quickly.
Well, a survey by the ANU released today found almost 2/3 of Australians believe that the rollout isn't going well. We've also seen a number of polls and surveys now looking at vaccine hesitancy. Do you agree that the hesitancy wouldn't be such a problem if we weren't just relying on that AstraZeneca? I mean, the polling seems to be suggesting that it's that brand that Australians are worried about as opposed to vaccination more broadly. I guess that brings me to your last point of the urgency of maybe trying to strike another deal, because it seems like Australians are avoiding AstraZeneca in particular.
Well, some Australians are concerned about the safety of the AstraZeneca vaccine, but that is an opinion that has been promoted through social media and through our mainstream media and doesn't sort of line up with the scientific evidence. Our vaccine experts are strongly recommending AstraZeneca for people over the age of 50. That is the government's view, it's the medical profession's view, and many Australians are rolling up their sleeves and getting the AstraZeneca vaccine. For those who choose not to because they don't believe the experts and they think they know better, well, you probably will get access to Pfizer down the track, but you'll be at the back of the queue, and that means you could wait for vaccination till towards the end of this year. I guess Australians have got to ask the question of, is that a risk they're willing to take?
Usually around this time of year, pre-pandemic, the big focus was always on the flu vaccination. Last year, flu infections were really at record lows. What is the expectation for this year? Is the flu vaccination as necessary this year as in previous years?
It's actually really hard to predict, having had such a low year last year as a result of our border restrictions, our high vaccination rates and our social distancing. And of course, that continues this year, less so with the social distancing, but certainly still got very strong border controls in place. Now, when you have a good year of flu, often the following year is bad because there's less immunity going around in the community generally. And that does make it actually even more important to go out and get the flu jab. As long as it's spaced 2 weeks apart from the COVID vaccine, it's certainly still a very good decision for every Australian to do, and particularly those at significant risk of the flu, because we know that the flu kills many hundreds of Australians every year. And when the flu does come back to Australia, it's going to be a bad year. Not sure if that's going to be this year, but we certainly recommend getting that flu jab.
So for Australians looking at the two jabs that they need to line up for, is there a consensus on which one is more urgent in terms of getting the flu vaccine first or getting the COVID vaccine first, if you have that option?
Look, I think if you've got access to the COVID vaccine, I would recommend getting that, because it is the harder one to access at the moment than the flu vaccine. And if you wait, if you're having AstraZeneca and you wait the 2 weeks, you can then have your flu vaccine quite safely, and the second AZ vaccine would be 3 months later. But if you haven't got access to the COVID vaccine yet, then certainly going and getting your flu jab now is a good decision.
Good tip. Dr. Omar Khorshid, the President of the Australian Medical Association, thanks for your time.
Thanks, Ash. Cheers.